Hello, my name is Mark Sisson-Curbishley. Today I'm presenting on the role of an OH physician. So contents of today's presentation, it's a bit of a whistle-stop tour, so please forgive me. So we'll do a bit of an introduction as to who I am and why I'm talking to you. We'll cover the role of what an OH physician is in general, the training that it takes to become an OH physician, potential for career progression, subspecialties that can be explored within occupational health, and there'll be some time for questions at the end. Let me just try and make Teams a little bit visible, so if anyone pops up with a message, I can actually see. Yeah, so as mentioned, my name is Mark Sisson-Curbishley, and I'm one of the PAM Occupational Health physicians. I have been working in occupational health since 2021, but joined PAM in November 2023. I've undertaken additional training in hand-arm vibration, offshore energy UK, which was previously known as oil and gas. I am also an appointed doctor with the HSE for lead, asbestos, and ionising radiation. So, what is an OHP or OH physician? So the generic overall definition is a doctor who is concerned with the protection of the health of the workforce and the prevention of occupational diseases and related environmental issues. So it's almost like a job spec, isn't it? When you get sent one attached to a management referral, that's a very kind of generic overview of things. But in terms of breaking down that definition a little bit, so doctor in this capacity refers to a registered medical practitioner, i.e., someone who is registered with the General Medical Council and not holding a PhD. And there's the British Medical Association have specifically made a statement as to who should and should not really use the title of occupational physician. So this person should have a relevant higher postgraduate qualification in occupational medicine, recognised by the Faculty of Occupational Medicine, and can demonstrate that they've achieved desired competencies in occupational medicine through training and experience, and maintain those competencies through CPD, continuous professional development, and complete annual appraisal relevant to their practice in occupational medicine. So, I mean, a lot, well, the kind of 3 and 4, you'd expect a kind of generic what you'd expect with any field of medical practice, but I think the BMA just like to be quite explicit and not let people rest on their laurels. Now, I've put a slide on the term specialist, and there is a reason for this. So specialist in the context of medicine has a legal meaning within European law. And so the only doctors that should be calling themselves a specialist, so for example, an occupational health or occupational medicine specialist, should be people who've completed formal higher specialist training in occupational medicine and are included on the GMC specialist register. So I will go into that in a little bit more detail in a second. But let's go back to considering a little bit more about the overall duties of an occupational physician. So there's quite a wide scope of bits and pieces that occupational health physicians keep themselves busy with. And so that can be a combination of things like visiting workplaces, which is important for things such as with your appointed doctor status with the HSE. When you do your annual returns to them, you do self-audit on your cases, and there's a declaration which says, have you been to visit the workplace to get a feel for what it is that you're actually providing services for. So that's one of the things that is important. Developing policies, practices, and cultures within workplaces to support kind of in regard to occupational health. Undertaking the assessment of fitness for workers. Now, obviously, quite a few people are involved in that. It's not just OH physicians. We've also got our OHA, OH nurses colleagues, as well as the kind of really valuable role that the OH technicians also play in that process. We undertake health surveillance. That's not just the OHAs, as mentioned, with things like the lead and asbestos. That falls specifically to OH physicians, but we also do provide advice with things like possible noise-induced hearing loss changes noted on audiograms. We also provide advice regarding work-related health issues, and so that's to include things such as reasonable adjustments and whether the Equality Act might apply in any given situation. And it, you know, that's not just providing advice with regards to here are some adjustments. It's also generally providing advice regarding the kind of effect of work on health and health on work, which is important because both have significant effects on each other. And as mentioned, it's kind of not just when someone has an underlying medical condition, but it's also about taking preventative measures. Uh, One specific example of that is with regards to asbestos. And when you undertake an asbestos medical, it's not to specifically say, oh, yes, you do definitely do or do not have asbestosis or fibrosis or what have you. It's saying, you need to avoid smoking and vaping because the interaction between that and asbestos can increase your risk of certain types of cancer by tenfold. So it's about being preventative and general health promotion. And it goes back to the health and safety of employees, which is being kind of central to all the advice that we give to employers. And that advice has to be impartial, from a medical standpoint, not getting involved in the he said, she said, X, Y, and Z of the situation. This is the medical advice. This is the medical opinion on this situation. I am Switzerland. And it has to be kind of clear and actionable rather than unintelligible waffle. Assessing potential cases of occupational injuries and illnesses. In my past life, I used to work kind of doing the benefits assessment side of things, which included specifically industrial injuries. So I have experience on both sides of the kind of almost like the occupational health spectrum. And we also provide input with regarding to managing immunisation programs for biological workplace hazards and for those who travel for business who might need exciting immunisations to prevent ill health whilst they're away. The next slide about duties. Sorry, it's very bullet pointy and there's lots of them, but we do a lot. So promoting best practice in physical and mental health. We also do that case management for workers who are on sick leave. Some of these kind of overlap with what I've kind of mentioned already, but it's nice to make it nice and clear. We work as a part of the multidisciplinary team. We all have very kind of important skills to bring to the table, and that's not just within kind of OH nurses, OH technicians, but also engaging with the employers, union representatives, other health specialists like physiotherapists, people's treating doctors. This also feeds into some of these other points that I will come on to, psychological services and neurodiversity experts. So we can help provide recommendations for suitable alternate work if someone's no longer able to do their usual role due to their health issues. Ill health retirement applications, again, liaising with treating doctors is really important for that, to robustly advise with regards to if someone does or doesn't meet the criteria for that particular scheme. Health education, and we provided education support for colleagues. We are a friendly, approachable bunch, I think. So yes, I personally really enjoy teaching and I really enjoy kind of giving support to people. And yeah, collaborating with other stakeholders. And that's what I was saying before about engaging with lots of other different people. So the scope of our work. So we've kind of covered the duties, but now the scope. So in terms of being an OH physician, generally you have to have a really, really broad scope of what you can kind of get your teeth stuck into. So that ranges from your industrial side of things, be that light, heavy or chemical. We've got uniform services, so fire service, police, professionals, NHS wise, doctors, nurses. Manufacturing and construction industries, lots of exciting hazards to kind of look at there. Food and retail. So again, food preparation, really important. Don't want to be like Typhoid Mary, passing on joyous communicable diseases. Central and local government.
Mary.
Hey, I thought it was a good reference. Central local government, or we tend to see quite a few of those for ill health retirement applications. And aviation is an occupational thing, but again, I'll come back to that shortly. And I've put ... because there's lots of other things, but I don't want to bore you. No death by PowerPoint, please. So the overall kind of training to get your foot in the door with regards to occupational medicine, going back to those very, very early slides, the first step is getting the diploma in occupational medicine, which is your DOCMed. So there are several approved providers, and when I say approved, they're approved by the Faculty of Occupational Medicine, and they cover the approved syllabus. Now, the overall course structure can vary, but it can range from it being done as a 2-week intensive course remotely. So, I mean, that was a little bit death by PowerPoint, I'm not going to lie. But some other places do it structured as in like 1 lecture a week for however many months, drawn out over kind of 8-12 months. Once you've then completed that actual training course, you get a beautiful certificate of participation, and that then gets you to apply for undertaking your exams, which forms 2 parts. You've got your multiple choice examination, and then you've got your kind of portfolio oral examination where you present 2 different cases. One is kind of a person that you've seen and given advice for and what the outcome was, and one is like a site visit where you've been around and identified hazards and done a full kind of risk assessment, and then you get grilled on that. So then, like I said, once you've done that and you've ticked all those boxes, you can officially call yourself an OH physician. But then consultant, and consultant is basically you can apply for a consultant NHS post. To get to that point, there's 2 possible routes. You can either go through an approved training program, which is called specialty training, which is structured over 4 years. And you get like a nice national training number, and you have to do kind of so many competencies per year and build up a portfolio that way. Or you can do your diploma, gain practical experience working in whatever role for whatever business. Or I do know of someone who has done it entirely as a self-employed OH physician, building up a portfolio that way, and you basically gather enough evidence to support you to say I've gained enough equivalent experience to be comparable to a kind of specialist training program. And then you get to what's called a CSER, which is a certificate of eligibility for specialist registration. And again, you then get onto your GMC specialist register, and that is when you are allowed to then call yourself an occupational medicine specialist. Does that make sense? So additional areas of interest. So as I kind of referenced in my initial introduction, some medicals are required kind of by law for specific hazards, and that includes things like lead and asbestos, ionizing radiation, and working compressed air. The process for kind of being able to undertake those medicals, you need to do additional training before then applying to the HSE to become an appointed doctor, who's therefore approved in undertaking such medicals. Things like the lead and asbestos, it's kind of a 1-day training course combining both. And once you've got that certificate, you then fill in an application form to the HSE. It's not particularly arduous, and it sounds a lot more kind of theatrical than it is, but that's just the process. Hand-arm vibration. So some of the OH nurses are qualified in undertaking the Tier 3. As people may or may not know, apologies if I'm teaching Granny how to suck eggs on this one, we take a tiered approach to hand-on vibration surveillance, with Tier 1 being an initial questionnaire when the employee starts, Tier 2 being an annual kind of review questionnaire, so they just kind of fill it in. If there are any notes of concern or points of concern on that, it would then be escalated to tier 3, which is a review with a qualified person, which is your OHA. But then for official diagnosis as to whether something is officially HAVS or carpal tunnel syndrome, that requires a review with a trained OHP, so someone who's undertaken specific training for hand-on vibration syndrome. Again, well, when I did it was a 2-day course. First day being lectures, and then day 2 was some practical practical clinical examination stuff, as well as then sitting 2 papers. I think the OH nurses just have to do the first paper, but then the second paper is for the physicians, and that's for the kind of official diagnosis side of things, though things might have changed. Do not quote me on that. Further additional areas, more training. Offshore Energy UK. So yes, that was previously oil and gas medicals. It is a 1-day course. They've recently updated the kind of standards. It still is a 1-day course. I've been reading and updating myself on that. But it's to give you an understanding of the working environment, because offshore is very, very different to onshore. It's also very remote. You can be miles and miles offshore, which requires access via helicopter, and helicopters do not run all of the time depending on the weather, and therefore it's really, really important that someone we try and reduce the risk of someone having or the possibility of someone being very, very unwell in an offshore environment where access to medical care is very limited. So understanding the environment, and B, the medical standards required. We've also got renewables, which kind of links into oil and gas. Slightly different, because going up and down those wind turbines is very, very different to kind of working on an oil refinery rig situation in the North Sea. Generally, for the renewable side of things, people don't stay offshore. It's just short visits offshore. And there's no formal training for that. There's kind of like this consultation policy health guidance document, which is a little bit difficult to obtain because it's being reviewed and updated and what have you. But in general, nurses can undertake the vast majority of the medical, but then they should have an OH physician available for reviewing and signing off when necessary. But again, under consultation, so subject to change. Additional areas, even more. You've got seafaring. Again, it's another application to, but this time to the Maritime and Coast Guard Agency. Once you're approved, you kind of have to demonstrate that you've got an understanding of occupational medicine, of the potential environment type thing. You're then sent a learning pack to complete, which sounds a little bit backwards in my eyes, but I don't make the rules. And then every year you have your approval renewed and on an annual basis. And we've got rail. We're nearly there, I promise. So this needs approval by the Office of Rail and Road, so ORR. Again, application form to demonstrate experience and qualifications in occupational medicine and knowledge of the rail industry and medical standards. So again, there's no real formal training for it. It's just showing that you have a good, robust understanding of the kind of risks and things and hazards. Now, I put aviation. I referred to it very early on. But I've put it in brackets because it is a whole different kettle of fish. It is a completely separate diploma course. I think when I looked into it, it was about £20,000. So I was like, no, I will not pay for this just yet. Thank you. So yes, but obviously that again involves very different physiological demands, working in different atmospheric pressures. So that's a very, very specialized thing in and of itself, which I do not know particularly much about because, as mentioned, I have not undertaken the training course. So therein endeth my whirlwind tour of what an OH physician is. Does anyone have any questions?